If you want to pull someone out of a spiral of terminal despair, uh, the absolute worst thing you can do is tell them to have hope.
Right, which goes against every single instinct we have.
It totally does.
Yeah.
I mean, when someone we love is suffering, our visceral reaction is to just, pump them full of optimism.
Oh, absolutely. We want to fix it.
Yeah, exactly.
Right.
We want to say things like, don't talk like that, or miracles happen, or you just have to stay positive.
The classic stay positive line.
Right. But today we are looking at a piece of source material where a palliative care nurse does the exact opposite. She basically kills the traditional idea of hope in order to save her patient's sanity.
It is such a fascinating approach.
Welcome to the deep dive, everyone. We are exploring a very short but incredibly moving transcript of a conversation between a nurse and a patient facing advanced last-stage blood cancer.
And it is intensely practical, too.
It really is. And our mission today is to deconstruct exactly what happens in that hospital room. We're going to highlight how this nurse uses specific mental grounding exercises to pull the patient out of despair.
And we'll be pulling out some really simple, actionable instructions for caregivers, too.
Exactly. Okay, let's unpack this. Because the mechanics of this conversation run entirely counter to how most of us are taught to handle grief or fear.
Yeah, it really is a masterclass in psychological resilience. But to understand the brilliance of what the nurse does, we have to look at the sheer weight of the patient's initial state.
Which is just crushing to read.
It is. When the transcript opens, the patient says, "I am very tired. The doctors have told me that my blood cancer is in its last stage. Sometimes I feel that there is no hope left for me."
And then they follow it up with that horrible rhetorical question.
Right, they ask, "What is the point of fighting now? I feel like everything is ending."
Man, that just paints a picture of someone who isn't merely physically exhausted.
Yeah.
They're psychologically pinned to the floor.
Completely immobilized.
Yeah. The future feels like this rapidly approaching concrete wall, and there's just no escaping it. And when someone you love says, what is the point of fighting now? The societal reflex is to jump in and play the cheerleader.
We want to instantly fix the sadness.
Right. But look at the nurse's immediate response.
Mm.
She doesn't offer a single shred of false optimism.
Mm.
Instead, she says, I understand that you are going through an extremely difficult time. You don't have to hide your feelings from me.
That phrasing is so deliberate.
It is, yeah. She tells them if you feel afraid, angry, or sad, you can talk about it.
What's fascinating here is that by saying you don't have to hide your feelings from me, the nurse is actively dismantling what we call the double burden of severe illness.
Double burden.
Yeah, so patients with terminal diagnoses aren't just carrying the biological weight of the disease. They're usually carrying this immense psychological burden of, well, performing bravery.
Oh, right, for their families and doctors.
Exactly. They feel this unspoken obligation to stay strong so that the people around them don't feel uncomfortable. And the nurse recognizes that this performance is just draining the last reserves of the patient's energy.
I think of it like a highly pressurized tire on a car. If you try to slap a patch on a tire that is overinflated and stretching at the seams, that patch is going to blow right off.
You have to let the air out first.
Yes, you have to bleed the pressure valve. If you don't release the immense pressure of the patient pretending to be okay, absolutely no mental grounding exercise you try afterward is going to hold.
That physical pressure analogy is completely accurate to what is actually happening in the nervous system, too.
Really? How so?
Well, when we suppress intense emotions like terror or grief, our bodies actually increase the production of stress hormones, things like cortisol and adrenaline.
Wow, so trying to be brave literally stresses your body out more.
Precisely. The effort of hiding the fear creates a secondary layer of physiological stress. By granting explicit permission to feel terrible, the nurse stops that secondary stress response in its tracks.
That makes so much sense.
And then she follows it up with this profound cognitive pivot. She redefines hope entirely.
All right, she tells the patient, sometimes hope doesn't mean that everything will become perfect. Hope can simply mean finding something meaningful in today. We don't have to solve the whole future today.
Notice the deliberate shrinking of the timeline there.
It's brilliant.
It is. The patient's mind has been obsessively projecting into this terrifying future, weeks or months down the line. The nurse takes that massive, unmanageable timeline and just condenses it down to a 24-hour window.
Just today.
Exactly. Just today.
Let's put you, the listener, in the room for a second. Imagine you are stepping into a caregiver role for someone facing a dark time. It doesn't even have to be a terminal illness, really.
Right. It could be a severe depressive episode or a massive life crisis.
Exactly. Your instinct will be to try and fix their tomorrow. But the rule we can extract from this transcript is clear. Rule number 1, do not immediately counter negative feelings with forced positivity. Validate the fear first.
Validate, then pivot.
Right. Rule number 2, you have to redefine hope for the patient. Shift the goalpost from getting better to simply finding one meaningful thing today.
Because you cannot give them back control over the disease. But you can give them back control over their immediate attention.
Which is huge.
It is. When the timeline is shrunk to just today, the brain stops trying to process the abstract terror of death and starts looking at the tangible reality of, the current Tuesday.
But getting the brain to actually stay on that current Tuesday is a completely different challenge.
Oh, absolutely.
Once the nurse temporarily sets that terrifying future aside, the patient admits something very relatable. They say, I keep thinking about my illness all the time.
Which makes perfect sense. I mean, how do you just stop thinking about a threat that is living inside your own body?
Right? You can't just command the brain to stop.
No, because the brain is an evolutionary survival machine. Its primary job is to keep you alive, which means it constantly monitors threats.
Yeah, and a terminal illness is the ultimate threat.
Exactly. So the brain's threat detection center, the amygdala, is just flashing red lights 24 hours a day. It is screaming at the patient to pay attention to the danger.
So if you can't talk the brain out of it, how do you bypass the alarm system?
You have to get physical.
Right. And here's where it gets really interesting. The nurse initiates what she calls a small mental activity. She asks the patient to close their eyes, if they're comfortable, take a slow breath in, and slowly breathe out.
It's the first line of defense.
Yeah, and she emphasizes, don't think about tomorrow for a moment, just notice your breathing. You are here right now, and I am here with you.
And what's amazing is the patient actually responds with surprise. They say, it actually feels a little calming.
I love that part. I want to look at the mechanics of this because I imagine the patient's mind like a runaway time machine. It is constantly, violently dragging them forward into worst-case scenarios.
That's a great way to picture it.
The breath acts as the physical anchor. It slams the brakes on the time machine and forces them back to the exact coordinates of the hospital bed.
Well, biologically speaking, the breath is the only autonomic function we have conscious control over.
Okay, break that down for us.
Sure. Your heart beats on its own, your digestion happens on its own, but you can choose to alter your breathing. When a person is trapped in that future-oriented panic, their sympathetic nervous system is highly activated.
That's the fight or flight response, right?
Exactly. Their breathing becomes shallow and rapid, which signals to the brain, hey, we're in danger. By intentionally forcing a slow, deep breath, you manually engage the parasympathetic nervous system.
Rest and digest response.
Right. You are sending a biological countersignal up the vagus nerve to the brain, basically telling it that the immediate environment is secure.
That totally explains the biology of the breath. But there is a linguistic choice the nurse makes here that feels just as vital.
Which part?
She says, I am here with you. She doesn't just stand at the door giving clinical instructions like some yoga teacher on a screen. She inserts herself into the exercise.
Oh, yes. That is a deliberate technique rooted in what psychologists call co-regulation.
Co-regulation. Okay, what does that mean in practice?
When an individual's nervous system is dysregulated by panic, it is incredibly difficult for them to self-soothe. They need another human being whose nervous system is calm to act as an anchor.
Wow, so she's literally lending them her calm.
Exactly. Future anxiety is inherently isolating. When you are terrified of your own impending death, you are entirely alone in that specific terror. By explicitly stating, I am here with you, the nurse neutralizes the isolation.
She creates a shared reality in the present moment.
She really does.
So for you listening, if you are sitting with a loved one who is spiraling into future-based anxiety, you need to interrupt it gently with a shared physical action. The instruction is not to tell them to breathe. It is to breathe with them.
You have to model it.
Yes, you have to model the slow inhale and exhale. And you need to say the words out loud. I am right here with you.
Yeah.
You anchor them in the physical room, but more importantly, you anchor them in the connection between the two of you.
It creates a temporary safe harbor. The immediate physical anxiety dials down.
But after calming that immediate physical anxiety, the nurse elevates the intervention. She refuses to just stop at calm.
Right. She uses that baseline of calmness as a launch pad to cultivate actual joy.
Which I have to admit feels like a massive leap. I mean, it almost sounds like we're bordering on that toxic positivity we just criticized.
The two definitely seem that way at first glance.
Yeah. The nurse introduces this 3 good things exercise. She asks the patient to name 3 things daily that made them feel slightly happy or peaceful. And I'll push back on behalf of the listener here.
Go for it.
If I'm dying and a nurse asks me to list 3 things I'm happy about, there is a very high chance I'm going to get incredibly angry. It feels dismissive of the massive tragedy happening to me.
That is a completely valid reaction, and it's exactly why the execution of this exercise is so delicate. The patient in the transcript actually hesitates.
Yeah, they assume it means big things.
Right. They say, 3 things, that sounds difficult. They are hitting that exact friction you just described. But we have to look at why the brain resists this prompt.
Okay, why does it?
It comes down to a concept called the negativity bias. Evolutionarily, our brains are wired to prioritize negative information over positive information.
Ah, right, to keep us safe.
Exactly. A beautiful sunset won't kill you, but a tiger in the bushes will. So the brain heavily weights the tiger.
And a terminal illness is the biggest tiger imaginable.
Precisely. The patient's brain is naturally filtering out anything that isn't the cancer. Furthermore, we are culturally conditioned to view good things as macro events.
Like graduations, or buying a house, or curing a disease.
Right. When the nurse asks for 3 good things, the patient's brain searches its inventory for a macro event to counterbalance the macro tragedy of the cancer, comes up empty, and concludes that the task is impossible.
And this is where the nurse intervenes to prevent that anger or frustration. She instantly rescales the prompt. She doesn't let the patient flounder.
She pivots so smoothly.
Yeah, she provides examples. She says, what about a family visit, a favorite song, sunlight coming through the window, a cup of tea? She radically lowers the threshold for what qualifies as a good thing.
She is recalibrating the patient's internal scale of value. She actively shifts the focus from macro loss losing their life to micro gains.
Like a held hand or a favorite meal.
Yeah.
And look at the immediate cognitive shift when she does that. The patient realizes they actually have an inventory.
They find things immediately.
Yeah. They say, my daughter visited me yesterday. She held my hand. Then my wife brought me my favorite food. And finally, they realize something in real time. They say, I think, talking to you now.
And the nurse replies, then today already has 3 meaningful moments. And the patient admits they never thought about it that way.
It's just so powerful.
It is. If we connect this to the bigger picture, this isn't forced positivity. The nurse isn't asking the patient to be grateful for the cancer. She is training the patient's neural pathways to widen their peripheral vision.
Right, like the tiger is still in the bushes, yes, but there's also sunlight on the grass.
Exactly. Practicing this daily trains the brain to scan the environment for positives rather than threats, which slowly builds cognitive resilience.
So practically speaking for the listener, the caregiver instruction here is to prompt the patient daily for 3 small, peaceful moments. But if they struggle, you have to provide hyperlocal sensory examples.
You really have to guide them.
Yeah. You might say, did you notice how nice the sunlight was today? Or how about that good cup of tea? You have to act as the magnifying glass for their joy to help them recalibrate their scale for happiness.
But we also have to acknowledge that the human mind is highly mobile. Grounding in the present brings comfort, but anxiety is a shapeshifter.
It really is, and
Yeah.
it doesn't just stay in one place.
Right. Once the immediate fear of physical pain is somewhat managed, the patient's anxiety pivots to something much more abstract and existential.
Yeah, the patient voices this incredibly raw fear. They confess, sometimes I am scared of being forgotten. The dread shifts from the future of their physical body to the future of their legacy.
This is the fear of erasure. The patient is grappling with the idea that not only will they cease to exist, but their impact on the world, their identity, the very proof that they lived it, will all slowly evaporate from the minds of the people they love.
It's an overwhelming psychological abyss.
It really is terrifying.
And the nurse tackles this head on. She guides them toward legacy building. She mentions writing letters or organizing photographs. But then she uses the past as a grounding tool. She asks the patient for a specific story.
She asks for their happiest childhood memory.
Right. And the patient immediately recalls being 10 years old going to the river with their father. The patient says, he taught me how to fish. I didn't catch anything, but we laughed the whole day.
Notice the methodology here. The nurse doesn't just accept a one-sentence answer. She demands sensory detail. By asking them to vividly recall the laughing, the father's smile, she is actively facilitating mental time travel.
I love that concept.
Yeah.
I look at this like the patient's memories are an unstealable vault.
Oh, that's a perfect analogy.
Think about the mechanics of what the illness is doing. The cancer is systematically robbing the patient of their future. It is stripping away their physical autonomy in the present, but the nurse directs the patient to the one space where the illness has absolutely zero power.
The past.
Exactly, the past. Mentally and emotionally, they were 10 years old, sitting on a riverbank, perfectly safe. And the nurse brilliantly points out that memory is still alive inside you. Your illness cannot take that memory away.
She reestablishes a sense of permanence for someone whose entire world feels temporary. The therapeutic brilliance of this is just incredible.
It really is.
When we vividly recall a deeply ingrained emotional memory, the brain actually replays the emotional state of that moment. The neural circuits associated with that joy, that safety, light up again. The nurse is essentially facilitating a mental grounding exercise through time travel.
She grounds them in a safe, joyful past. So, for the caregivers listening, when a loved one fears being forgotten, give them a concrete project. Offer to record their stories or make photo albums.
Get them talking about those specific details.
Right. Ask specific, open-ended questions about their favorite memories. You are helping them mentally inhabit spaces the illness cannot touch.
It is a profound intervention.
It is. But we have to pause and reflect on the reality here. Despite these wonderful tools, the reality of advanced cancer means bad days are inevitable.
They absolutely are. There is no psychological tool on Earth that turns every day of advanced cancer into a good day.
So what does this all mean for the days when exercises just aren't enough, when the pain spikes or the terror is just too dense to pierce with a happy memory?
The patient brings this up, actually. They ask, what if I have a bad day?
And the nurse's response is amazing. She immediately removes the pressure to perform. She says, then we don't have to pretend it's a good day. On difficult days, your only goal can be to get through that day with comfort and support.
It's so validating.
It is. She redefines strength entirely. She counters the patient's belief that being strong means never crying. She says, true strength is admitting I am scared and I need someone beside me.
This raises an important question about our societal definition of bravery, especially in the context of terminal illness.
Oh yeah, like the whole battle metaphor.
Exactly. We constantly use battle metaphors. We call patients fighters and warriors. While that mindset can be empowering for some early on, in the late stages, it often forces patients into this stoic silence.
Which is deeply isolating.
It is. They internalize the idea that if they cry, they are failing. The nurse shatters this by giving explicit permission to cry and be afraid.
I want to push back on this a bit, though, and think about the caregiver.
Okay, sure.
Conceptually, giving someone permission to fall apart sounds beautiful. But in practice, it is excruciating for a caregiver. Imagine sitting next to your husband or your child and watching them weep in absolute terror.
It goes against every instinct to just let them cry.
Exactly. Your biological instinct is to make it stop. You might feel like you are failing if your loved one is crying. You want to distract them or tell them it's going to be okay.
But you can't fix advanced cancer.
Right. And trying to fix their emotional release inadvertently invalidates their terror. So, arguably, sitting comfortably with someone's despair without trying to fix it is the ultimate form of caregiving.
It's what therapists call holding space. You become the emotional container for them.
So the instructions for the caregiver are clear. Explicitly give your loved one permission to have a bad day. Say out loud that they don't have to be strong every minute.
Just letting them off the hook.
Exactly.
Sure.
And accept that on a bad day, the only goal is presence and comfort, not progress.
But we also have to look at what happens when that fear becomes completely overwhelming. Because there is a threshold where emotional release tips over into a physiological crisis.
Like a full-blown panic attack.
Right, when they can't catch their breath and their mind is spinning. For those moments, the nurse provides a highly structured emergency break.
She introduces a really potent grounding exercise. She tells the patient, whenever you feel overwhelmed, look around the room and name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you are grateful for.
This is an absolute staple in trauma therapy. It's known as the 5-4-3-2-1 sensory method.
And the patient successfully tests the visual aspect right away. They name the window, the chair, the uniform, the flowers, and their photograph. And immediately they say they feel less anxious.
It works so fast.
It's like rebooting a frozen computer. When the brain is overloaded with fear, you force it to allocate processing power to immediate sensory data, and it literally short-circuits the panic.
The computer analogy is perfect. When a panic attack hits, The amygdala consumes massive amounts of processing power, looping terrifying thoughts. But the brain has a limited amount of working memory.
And this exercise exploits that.
Exactly. I'd love to break down why this specific sequence matters.
Please do.
Naming physical objects in the room demands high cognitive focus. You start with vision, which is the easiest. But as you move down, the cognitive demand increases.
Touching things, isolating sounds.
Right. The brain simply cannot process abstract existential terror while simultaneously analyzing the specific texture of a bedsheet. By the time the patient gets down to one thing to be grateful for, they have physically re-inhabited their room.
They aren't in the abstract space of their fear anymore?
No, they aren't. And the nurse reinforces this by saying, "Excellent, you're bringing your mind back to the present."
So caregivers, you need to memorize the 5-4-3-2-1 method. When your loved one is spiraling, walk them through it slowly. Do not rush the countdown. Let them fully engage with each sense.
It is your emergency brake.
Now, by this point in the conversation, the patient has completely transformed. They went from feeling there was nothing left to realizing there is still today.
The shift is incredible to witness.
It really is. But we need to explore how the nurse seals this transformation before she leaves the room.
Right, because leaving a patient calm is only half the battle. Leaving them with a sense of purpose is what cements the resilience.
Exactly. So she reminds the patient of their wide support system, their family, the doctors, counselors. And then, crucially, she asks the patient to relax their shoulders and think of just one person they want to talk to today.
Just one person.
The patient chooses their daughter, and the nurse makes that the sole goal for the day.
The genius here is scaling down ambition. A goal isn't curing cancer or making peace with death. It's simply talking to a daughter today.
Taking it one moment at a time.
Exactly. It restores a sense of agency and control to a patient who felt entirely powerless.
And I just have to point out the realistic ending here. The nurse doesn't cure the patient's fear. The patient explicitly states, "I still have fear," but the isolation is cured. They say they don't feel as alone anymore.
That honesty is what makes this so powerful. You cannot cure the fear of death, but you can cure the isolation.
So caregivers, help the patient set one tiny, achievable social or personal goal for the day, and continuously reiterate that they do not have to fight their fears alone.
It's about profoundly structured psychological presence.
Let's summarize the incredible toolkit we've extracted from this source today. We started with validating emotions instead of forcing toxic positivity.
Letting the air out of the tire.
Right. We talked about redefining hope to mean today and using shared breathing to halt future anxiety.
We unpacked the 3 good things practice.
Yeah, shifting focus from macro loss to micro gains. Then we looked at using memories as an unstealable vault to counter the fear of erasure.
Redefining strength as asking for help.
Exactly, giving permission to fall apart. And finally, the 5-4-3-2-1 sensory grounding method for panic attacks.
It is a remarkable set of tools.
It really is. But I want to leave you, the listener, with a final provocative thought to mull over. The text focuses on a patient at the end of life. But isn't the nurse's central premise true for all of us?
It absolutely applies to everyone.
We are all guaranteed only today. So consider how differently you might experience your own daily anxieties if you stop trying to solve your whole future today. What if you just looked around the room and found 3 small things that brought you peace right now?
It would change everything.
Thank you so much for joining us on this deep dive. We encourage you to carry these grounding tools into your own lives and into the lives of those you care for.